Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Ashermann syndrome. Ashermann syndrome. The endometrium in Ashermann syndrome is thin and defective. Because the endometrium is thin and defective, the patient will have hypomenorrhea or amenorrhea. So the most common presentation in Ashermann syndrome is menstrual irregularities like hypomenorrhea and menorrhagia.
In Asherman syndrome, due to the adhesions, the bleeding cannot come out, and because there is thin endometrium also. First of all, in Asherman syndrome, there is thin endometrium and there are intrauterine adhesions. So, as a result, there is hypomenorrhea and amenorrhea is seen.
Most common single problem in Asherman syndrome is infertility. In Asherman syndrome, the causes of Asherman syndrome are vigorous curettage or curettage in postpartum period, genital tuberculosis or cystosomiasis. In all these conditions, there is intrauterine adhesions are present. Investigation of choice is hysteroscopy. On hysteroscopy, for either it is both diagnostic and therapeutic. First, on hysteroscopy, you will see presence of scarred tissue or adhesion is seen. That is, you will see multiple filling defects with irregular lining. On ultrasonography, you will see adhesions also. Treatment. In treatment, we can do hysteroscopic adhesiolysis is done and you will insert a balloon catheter, or you can insert a pediatric Foley's catheter is inserted. Along with that, you give estrogen and progesterone to make the endometrium thick. Ovarian
thank you and thank you for watching.